History is littered with successful business being disrupted by new technologies and upstart companies who redefine markets and deliver value in new ways. Kodak, BlackBerry, Nokia, and Blockbuster are just a few iconic companies that have been disrupted in recent years. But disruption is not new. It has been around for generations. While disruption vary in time and intensity, they tend to follow similar patterns and show same characteristics. So let us start with what really disruptive innovation is. A lot of people misinterpret disruptive innovation with breakthrough or radical innovation, and unfortunately, this is not the case. Disruptive innovation does not mean to make a product revolutionary by increasing the features of an already present product, but it is an innovation that allows a whole new population of consumers to afford to own and have the skills to use a product or service, whereas historically the ability to access was limited to people who have a lot of money or a lot of skill. According to Christensen and Rayner, to determine whether an idea has disruptive potential, companies must ask three sets of questions. Number one, can the innovation help a large number of population begin owning and using the product who have historically not had the resources to do so, and thus cause a market disruption? Second, does the innovation have the potential for low-end disruption by finding customers who would be happy with the product with low but good enough performance if they could get it at a lower price? And finally, is the innovation disruptive at all significant incumbents in the industry, rather than being sensitive to one or more significant players? Ega et al. Have come up with 6 catalysts for disruptive innovation. He says the innovation is not a sustaining technology, so it will not result in price inflation. Secondly, it should be produced by an organization autonomous or separate from the incumbents who dominate the market. Thirdly, the innovation has to be less expensive than the traditional technology. Also, it maintains cost competence over time. The innovation should be enabled by a rapidly evolving technology, so it may start off worse than the existing product, but it improves over time. And finally, the innovation should demonstrate effectiveness in real-world use. Now let's talk about disruptive innovation in healthcare. Disruptive innovation has been discussed much in the healthcare context, both in developed and developing countries. So what really does disruptive innovation mean for healthcare? We need to answer this question from the perspective of different types of healthcare systems and the challenges they face. The United States of America has one of the highest costs of healthcare in the world. In 2017, the US spent $3.5 trillion on healthcare, which averages to about $11,000 per person. Relative to the size of the economy, healthcare costs have increased dramatically over the past few decades, from 5% of GDP in 1960 to 18% in 2017. The Center for Medicare and Medicaid Services projects that such costs will climb to $6 trillion or about $17,000 per person, and will represent 19% of GDP by 2027. On the other hand, 1.6 million Africans died of malaria, tuberculosis, and HIV-related illness in 2015. These diseases can be prevented or treated with timely access to appropriate and affordable medicines, vaccines, and other healthcare services. Without access to medicines, Africans are susceptible to the 3 big killer diseases on the continent: malaria, TB, and HIV. According to WHO, globally 50% of children under 5 years of age who die of pneumonia, diarrhea, measles, HIV, tuberculosis, and malaria are from Africa. Disruptive innovations can solve many, if not all, prevalent enigmas in healthcare. The 2 major problems to solve are: first, how to tackle the escalating costs in high-income countries, and second, how to improve access to healthcare in low-income countries. The enabling disruptive technologies and business models that can help drive down healthcare costs are fairly well understood. Retail clinics, telemedicine, single-organ hospitals, surgical robots, medical tourism, and personalized medicine are just a few of the disruptive healthcare models that hold tremendous promise, breaking traditional price and performance trade-offs in the healthcare sector. Visual patient visits, for example, can cut down costs by 1/4 of the price. Point-of-care diagnostics like Butterfly IQ, Philips Lumify, GE Healthcare Mobile Scanner, and instruments like iKnife have all disrupted healthcare in one way or the other in high-income countries. In low-income countries, the architecture of disruptive innovation varies considerably, and it can be very complex at times. Say for Arvind Eye Care Hospital and Narayana Hrudaya Healthcare Center in India are organizational innovations embracing many elements, including and not limited to process, business, service models, technology, and many more. Talking about the Arvind Eye Care Hospital, it performs almost 350,000 eye surgeries a year, but 60% of these surgeries are delivered at low or no cost. It is the world's largest provider of cataract surgery and has now also evolved as a local lens and suture manufacturer. The cost of these surgeries is 50% less than those provided in the US hospital. Because of its success, this model has now been replicated in Mexico as well and has been very successful. But the question is, can this disruptive model of Indian hospital be replicated in high-income countries like US and UK and help them reduce their healthcare costs? Experimentation and innovation in approaching to healthcare provision in less developed regulatory framework of low and middle income countries has led to development of many potentially disruptive innovation. However, the same innovation can be deemed as malpractice in US or UK due to the strict medical legal framework of these countries, thus limiting the transferability of these models in high-income countries. Also, there are no equivalent efficiency and cost savings in transferring Indian specialty hospital models to US or Europe. Government and healthcare industry leaders need to step forward to help insurers, regulators, managed healthcare organizations, hospitals, and health professionals to work together to facilitate disruption instead of unify to prevent it. If they do so, some of the established institutions will fail. Many more healthcare providers will realize the opportunity for growth that come with disruption.